Before you start any clinical procedure, ensure you're working in a clean and tidy environment, that you're bare below the elbows, and that you have all the equipment that you need. For an aseptic dressing technique, you need a clinical trolley or clean and clear work surface to open your equipment on and to work from. Using detergent wipes, clean all surfaces of the trolley, starting at the top and working down. For the horizontal surfaces, work by wiping in a zigzag manner, backwards and forwards, never returning to an area already cleaned. For each upright, take the wipes from top to bottom in turn. Make sure you've cleaned all the shelves. And dispose of the used wipe into a foot-operated domestic waste bin. Clean your hands. We would suggest with soap and water to rinse off any detergents from the wipes. Use a thorough technique each time you clean your hands, ensuring product comes into contact with every skin surface. Next, load your trolley with the items you'll need, including the dressing pack, dressing, cleaning fluid, tape if necessary, and wound swabs if samples are planned. Make sure you have enough supplies on the trolley without risking waste. You may need an apron depending on the type of dressing pack in use. Talk to the person about their wound. You could ask them how they've been feeling, if the wound has been painful, if the dressing has stayed on well. You should also let them know what you're going to do and seek consent to carry on. If they are able, they might like to start to loosen the dressing themselves. You will be able to assess the wound from conversation with the person and decide whether to make any changes to the treatment. Open the dressing pack, allowing it to drop onto the trolley. Do not let the external wrapping touch the trolley at all. Then, taking just the corners, unfold the dressing pack, revealing the contents. This is your sterile field. Some packs have a sterile apron and some do not. In either case, standing away from the trolley, put an apron on. Taking the waste bag, put your hand inside it and use it as a third glove. Use the bag to arrange the contents of the dressing pack, making sure they don't touch beyond the sterile field. All these items are sterile. Don't let them become contaminated. Still using the bag as a glove, lift off the used dressing, inverting the bag over it to enclose it inside. Using the sticky tape provided, secure the bag to the trolley. Next, checking dates as you go along, empty all the sterile equipment onto the sterile field by peeling back the paper and letting things drop onto the surface. If you're going to be using a fluid for cleaning, for instance, pour it carefully into the receiver. Never put anything non-sterile, like reusable scissors, onto the sterile field, which would contaminate it. Any clean waste generated, like wrapping paper, can be put aside for disposal later on. You can put it in the waste bag later. Clean your hands now. Hand rub gel is the most convenient. Before we watch Penny, let's think about the sterile gloves. They will be arranged so that the cuff of each glove is folded back on itself. In picture 3, it shows the hand taking the first glove just by touching that cuff. Picture 4 shows the hand being inserted into the glove without contaminating the outer surface of it. It's important that this stays sterile. Once that hand is gloved, pick up the second glove, like in picture number 5. Now with your gloved hand you can touch the outside of the second glove, but you don't want to touch your skin. So put your second hand into the glove and pull down the outer surface of the glove over your wrist. You're not contaminating the first glove and you're not contaminating the second glove. When you've done all this, those gloved hands cannot touch anything that is unsterile until the end of the procedure. Now that you're wearing sterile gloves, you can touch the items on your sterile field, but nothing else. Place the sterile sheet under the person or under the limb to catch any spillages and to cover the surface immediately around the wound. Avoid contaminating your gloves. You've already added the swab to your sterile field. Collect any clinical specimens. Once collected, put aside or on a lower shelf for later. Pick up your sterile gauze and dampen if necessary. If you're going to clean, do so with single strokes of the gauze. Do not dab or return to an area once cleaned. Dry if necessary. Place the dressing over the wound following any manufacturer's instructions. Don't touch the bed of the dressing. Check that the person is comfortable and that they know how to look after their new dressing. Provide some instructions on what to do if there's visible wound leakage or the dressing gets wet or uncomfortable. Tidy up the waste generated by placing it in the waste bag. Remove the gloves carefully without contaminating your skin. Do this by taking the outside of the first glove, pulling it off, and then the inside of the second glove. Remove the apron carefully, being careful only to touch the inside surface. Seal up the bag and dispose of it as offensive waste into the tiger stripe bag. And then clean your hands. Label any samples and fill in the pathology form with as much detail as possible. Clean the trolley again with detergent wipes. Clean the surface that the service user has been on and the pillow as well. And then clean your hands as you finish.